Welcome to the all viewers and well wishers of the world. The purpose of my lecture is learn the knowledge from the word and return the knowledge to the word. Motto of my life is learn, earn and return. I have learned a lot, earned a lot, now to return a lot to the word. The topic of today's discussion is Tinea Pedis, which is also called athlete's foot because it is mostly seen in the athlete foot. First of all, what is tinea in general? Tinea is a common fungal skin infection, also called ringworm tinea. It affects any part of the skin on the human body from head to toe. Ringworm is not caused by a worm, as the name is, but this is a fungal infection, forms a ring-shaped rash. Other similar rashes can look like ringworm, like spider bites, nubular eczema, and Lyme disease, but these are not actually the fungal infection as the tinea or the ringworm, which is a fungal infection. These are not serious, but these are uncomfortable. As one can see, these are the tinea infection which can be seen on any part of the human body, and these are the forms of rings. These are formed on the body on the basis of that, which is sometimes called ringworm. Now, coming to the actual topic, which is Tinea pedis, the other name for this disease are ringworm of the foot, moccasin foot, or athlete foot. It is member of the group of diseases known as tinea, so the name is Tinea pedis. Pedis is the other word for the foot. For that reason, it is also called athlete foot. Tinea pedis is most prevalent of all the dermatophytoses. It varies with geographical location. It is a fungal skin infection that begins between the toes, bottom of the feet, and also involves the nails. It is seen in people whose feet are very sweaty and confined within tight fitting shoes, so that there is laceration and the sweat is there. It may spread from other animals. Men are infected 2 to 4 times more than the women because men most of the time wear the shoes. It is closely related to the other fungal infections like ringworm and joke itch. Now, one can see the feet, and in between the toes one can see the fungus that is growing there. So it is the fungal growth in between the toes, as one can see from this diagram. Also, this diagram also shows that the fungus growth from feet, as the name is Tinea pedis or athlete foot. Now, symptoms of this disease are itching, scaling, redness of the foot, cracking, and rarely skin blisters are seen. Causes of this disease are different fungi, including species of trichophyton, epidermophyton, and microsporum, which I usually call MET, collectively MET for microsporum, epidermophyton, and trichophyton. Now, diagnostic method is based on symptoms, and it is confirmed by the culture or the microscopy of the fungus. Prevention is avoiding walking barefoot in public showers, keeping the toenails short, wearing the big shoes, and changing the socks daily so that one can prevent its spread. Treatment is antifungal medication applied to the skin topically or taken by mouth orally, but infection comes back and frequency of the infection is about 15% of the population is infected. Here are the lesions of the Tinea pedis. It can be here at this place, it can be here on the side of the foot, and also it can be here, but mostly it is found in between the toes, as one can see. These are the classical sites where the infection can be seen in the athlete foot. Now, about the history of the disease, athlete foot was first medically described in 1908. Historically, it is a rare condition, became frequent in 20th century due to the greater use of shoes, health clubs, war, and travel. Cases of athlete foot were first documented in 1916 during the World War I, where the people used to use the shoes. By 1928, cases were alarming because of pools, colleges, and athletic clubs, which are the potential source of spread of this problem. Antifungal properties of the compounds containing zinc and dicyclinate were most effective treatment topically being used previously. It was used in Vietnam War and World War II so that there was reduced incidence of this infection. Now, coming to the epidemiology of the disease, males are more affected than female, as I have told you that male do wear the shoes during the job, so they are more prone. Mostly seen in older children or the younger adults. Globally, it affects about 15% of the population and 20% of the adults. 85% of the college students definitely wearing the shoes are also prone to have the problem. And they experience 70% of population experience athlete foot at some point in their life because they have definitely worn the shoes in their lifespan. It is common in minors, soldiers, and athletes. Activities like marathon runners, those who are wearing the shoes for the longer duration. Going barefoot has the low rates of the athlete foot than population which wear the shoes. So just going barefoot is not predisposing to the infection of this feet. So the disease is called a penalty of civilization wearing the shoes. Now, the causes of the disease, dermatophytosis, that is the fungal infection of the skin caused by the dermatophytes, fungi. Mostly the molds are responsible for this disease. These inhabit the dead layers of the skin and digest the keratin of the skin. Dermatophytes are anthropophilic because these are parasitic fungi and they prefer to live the human and they prefer the human host. Secondary infection with the skin flora like micrococci, corynebacterium, and the gram-negative bacteria can superedit the infecting these lesions also. It is caused by the different fungi, including the species of trichophyton, epidermophyton, and microsporum met, I have already told you. But mainly there are 4 causative agents for this disease, and these are number 1, trichophyton rubrum. Source is people with a chronic infection of Tinea pedis because fungus not long lived in the squam shed off, and they are the potential source of spreading infection to the other people. Then second is trichophyton mentagrophytes. The third is epidermophyton floccosum. Source is long-lived and arthrospores that reside in the squames, as I have told you. These shed on the ground and responsible for spreading the infection to the other feet. Number 4 is Trichophyton interdigitale. It is a name recently given after molecular studies to this new species. Now, here one can see the Trichophyton rubrum. The structure of this fungus is like this. One can see the rounded the spores of this fungus, which are here. One can see epidermophyton flocculum with the spores like this, and Trichophyton interdigitale, and their spores are like this, and here Trichophyton mentagrophytes, their spores are like the peas. So these are the different shapes of the fungus which can be recognized under the microscope. Now, there are certain risk factors that is predisposing to this infection. Athlete foot is not limited to just athletes. Anyone can get athlete foot. Clothes or shoes, body heat, and sweat keep the skin warm and moist. Environment fungus needs to thrive, and that is the very healthy site for the fungi to attack. Previous history of the same disease, psoriasis or the atopic of the dermatitis, also predisposed to this condition. Adults are more prone than children, and men are more prone than women. I have told you the occupational problem. People with the diabetes or the weakened immune system like HIV, AIDS are also very prone. Hyperhidrosis is a condition in which there is abnormally increased sweating in the body, that is also prone to have this fungal infection, and that also this disease makes the treatment difficult because of increased sweating. Now, the continuing the risk factor, sharing the mats, rugs, bed linens, clothes, or the shoes with the person having this infection can spread the problem. Exercising in public sports facilities, swimming pools without protective footwear, letting the toenails grow too long also give the fungus to grow there. Wearing shoes that are too tight, giving less hair to the feet, and not changing the socks daily. Wearing unventilated occlusive footwear such as the rubber boots or vinyl shoes, that is also generating moist conditions which promotes fungal growth. And for a man to conquer himself is the first and the noblest of all the victories. The other victories are just all secondary. First, you have to conquer yourself. Now, transmission of the disease is very contagious, can spread, number one, via direct spread by touching the infection, host to host, through the infected squames. I have told you these fall off on the grounds, and these contain the fungi and can spread to the other feet. Indirect spread is by coming into contact with the contaminated items like the clothes and the towels of the infected people. Surfaces like bathroom, showers, or the locker room floors, these are having the infected squame on the floor and can spread the infection. As flat, keratinized, dead cells shed from the outermost stratified squamous epithelium of the infected person, and fungi travel on these dead skin cells, and fungi reach to the feet from the other areas of the body. by touching or scratching the affected area. So the person can just transmit infection from his own different body parts to the feet by scratching and spreading the infection to that feet. Now, the transmission continuing in petting, fungus from the pets can spread to the hands and fingers of the people who have the pet animals, those who are infected, and from the hands one can have these infections. Fungi can easily spread to the environment and then acquired by the contact with the environment. So that is the other source that one can get it through the environment. Viable propagules of the dermatophytes shed from the feet with Tinea pedis and the fungi in the area where the people walk barefooted. Also, the host susceptibility factors are also involved, that some people are more prone, more susceptible as to the other people. Fungi do not spread deeper than the skin. It don't involve only the superficial part of the skin. Bacteria do enter through the cracked skin of the untreated athlete foot, as I have shown you. So that is the open invitation for the bacterial infection to cause the secondary bacterial infection over the nails. Sometimes it is spreading to the nail, as the nails are also part of the fingers. Now, what are the signs and symptoms of the disease? It can affect one or both feet. There are scaly peeling or the cracked skin between the toes, dry scaly skin on the bottom of the foot that extends up to the side of the foot also sometimes. There is itchiness, especially right after taking off the shoes and the socks. There is burning or stinging sensation, inflamed skin that might appear reddish, purplish, or the grayish, depending on the skin color of the patient. Sometimes the blisters are also seen. So the symptoms of the athlete foot are: number one, itching and the stinging between the toes, as one can see. Then small blisters at the edge or the top of the feet can be seen. Then cracked skin between the toes, as one can see, and that is very prone to invite the bacterial infection. Then there is dry, flaky skin on the sole of the foot. That is also one of the variety. Now, there are different types of the Tinea pedis. Mainly, there are 4 types or presentation. Number 1 is acute ulcerative Tinea pedis. Number 2 is chronic interdigital Tinea pedis. Third is plantar or chronic scaly Tinea pedis. And fourth is vesiculo-bullous Tinea pedis. Their names are self-explanatory and that can tell the nature of the lesion and the type of the lesion. First, we are going to discuss acute ulcerative Tinea pedis. As the name is, there is itching, red, vesicular and blister formation, soreness of any part of the foot. Itching is worst after taking off shoes and socks. The web spaces become red, scaly and macerated, occasionally with the edema. And maceration is softening and breaking down of the skin due to the extensive exposure to the moisture. It spreads to the palms and the soles also. So continuing acute ulcerative Tinea pedis, there are vesicles and the inflammation plus occasional pustule and the bully, as the name is ulcerative. So an odor is there due to the secondary bacterial infection. It is mostly caused by the granular zoophilic member of the Trichophyton mentagrophytes complex. Number 2 variety or type is chronic interdigital Tinea pedis. The name is self-explanatory that it is found mostly in interdigital spaces. Means between the toes, mainly space between fourth and fifth digit, little toe and foretoe, caused by the trichophyton rubrum, either symptomless or it present with itching, burning, scaling and fissures. There is secondary bacterial infection causing cellulitis or deep soft tissue infection. And here one can see the acute ulcerative Tinea pedis. One can see the different ulcer here, and here one can see the extensive ulceration that is telling acute ulcerative. And here chronic interdigital, one can see the infection between the digits, and so the name is chronic interdigital. The chronic interdigital Tinea pedis, sometimes systemic infection can occur if the infection is quite extensive. It is of the following three types: intertriginous form, most common with maceration, scaling, fissuring and erythema. Number 2 variety is vesicular type, there are vesicle formation there. And third is ulcerative type, so mostly there are ulcer seen. Third type is plantar chronic scaly Tinea pedis. As the name is, there are more scale and it is found on the plantar surface of the foot. It is also known as moccasin foot or the chronic hyperkeratotic type, referred to the sole of the foot. It is caused by trichophyton rubrum, either asymptomatic or there is sharply marginated erythematous plaques or scales on the plantar surface or the sole of the foot. So the name is plantar or chronic scaly. Here one can see the scaling of the plantar surface, and here also one can see the area typically affected by the interdigital Tinea pedis, as one can see the digit is, and this is the area typically affected by the moccasin form of the Tinea pedis, as one can see here. Here the sole of the foot or the plantar surface of the foot is involved. Now the plantar chronic scaly Tinea pedis is also on the lateral border of the feet and on the heels, often associated with the fungal infection of the nail, and the infection spread to the nail, so it is called now onychomycosis. It is covered by the fine powdery hyperkeratotic scales, and sometimes it is mistaken for eczema or the dry skin. The fourth type of the Tinea pedis is vesiculobullous Tinea pedis. So there will be bully there, and the name is, it is a type of mucocutaneous disease with vesicles and the bully, the blister. So the name is that. These are fluid-filled lesion on the arch or the sole of the instep. It is distinguished by the size. Vesicles are less than 5 to 10 millimeter in size, and the bulli are more than 5 to 10 millimeter in size. It is a less common disease, usually caused by trichophyton mentagrophytes. It presents with a sudden outbreak of itchy blisters and vesicles on an erythematous base on the sole of the foot. It represents delayed hypersensitivity, immune response to dermatophytes, so occurs also late. It is often complicated by the secondary bacterial infection by the Streptococcus pyogenes or the Staphylococcus aureus bacteria. Here one can see the vesiculobullous type of the Tinea pedis. One can see the bulli there and the vesicles here. So the name is vesiculobullous type of Tinea pedis. So the four types of these Tinea pedis, we do have the clinical picture. First, intertriginous affects the toe webs, producing the chronic scaling and maceration, and there is interdigital infection. Papulosquamous pattern is thick scaling over the entire sole of the foot, causing the discomfort. It affects the soles and the lateral aspect of the feet. The skin covered were one wearing a moccasin-like. Moccasin is the type of shoes which was in the past being used as a shoe type, but nowadays it is very rarely seen. So the name is moccasin. Vesicular or vesiculobullous type, as the name is, it affects instep and the mild anterior aspect of the sole, small, confluent, vesiculopustular, surrounded by the scaling, and the ulcerative type, as the name is, maceration and the ulceration of the large area of the soles. There is a peeling, oozing discharge, and a strong odor is there because of the superadded bacterial infection. Now, there are certain grades of the Tinea pedis. There are 3 grades of the Tinea pedis which are named as grade 1, grade 2 and grade 3. The grade 1 is called subclinical, and itching between the toes, skin soft and macerated, blistering may be seen also. Treatment is keep the feet dry and clean between the toes after the bath to remove some skin. Apply fungicidal powder topically or the ointments containing salicylic acid or tonaphtate like cream also. It promotes peeling of the skin and just help in healing. The grade 2 is host is conscious of the burning sensation while walking and standing. So that is the grade 2 scale. And it in grade 2 remove the liquid from the blisters by puncture near the base or unroofing the blister to make squeeze the fluid out. Soaks are used like paints or the liquids like 1 into 4000 potassium permanganate. It stains the skin purple, otherwise it is very beneficial. Magenta paint or topical fungicides are also used. Dusting powder in the morning is used to keep the feet dry. Now, in the grade 3, a secondary bacterial infection occurs, so one has to use the systemic antibiotic to cover the bacterial infection. If the infection subsides, treat it like a grade 1 and grade 2, I have already told you. For persistent cases, use the systemic antifungal like glycofulvin or Lamisil or terbinafine to just get control of this grade 3.